Hi everyone, Ethan Wong here again with Layman's Medical. Today I want to discuss a very important topic that lays heavy on our hearts. No puns intended. Today's topic is angina, which is a lack of blood flow to your heart event that causes symptoms, versus heart attack or myocardial infarction, which is a muscle damaging event. It is important to differentiate between the two because it relates to the urgency of the matter. As usual, before we start, just want to reiterate that none of the contents in this channel serves as a formal medical consultation, and in the commenting section, please keep it to a HIPAA-compliant mindset before you're commenting. In other words, no personal health information. And as usual, let's look at a visual demonstration on the illustrator to differentiate between the concept of angina versus myocardial infarction. So without further ado, let's move over to the illustrator. Let's take a look at a diagram demonstration of angina versus myocardial infarction. Here is some base images created with Paint's 3D. In the event of angina, and the diagram is going to show an artery with a plaque formation where the yellow lines are. And let's just say the direction of the flow is this direction arbitrarily. You had a 75% plaque formation over years, which that gives you time to develop some collaterals, and that reduces the flow to that diameter, unfortunately, in the main artery. But you have some outside flow, or natural bypasses if you want to call them. In the case of myocardial infarction, and here's a diagram of the base artery again, and let's just say the flow is going this direction, and the yellow lines again represents a plaque. The normal flow through your artery is very smooth, called a laminar flow, in a smooth blue lines. Let's just say you're upset, your blood pressure goes up, and then the flow can become turbulent where the red arrow is pointing to. The turbulent flow can shear open a soft plaque. So in this case, 20% plaque, that's soft, that gets busted, and then your body immediately responds to it, sees it as a foreign body, it sends immune cells and clotting factors. The problem with this is that you go from 20% to 100% blockage in the matter of seconds. You have zero time to develop any collaterals or natural bypasses. So this is a case of heart attack, which is a muscle damaging event, which is an emergency. Okay, so we just had a chance to look at a visual demonstration of angina versus myocardial infarction, and as we can see that in the event of angina, the plaque formation has occurred over the years, which means that gives you plenty of time to develop other branches around that artery to allow additional flow. So you do not truly achieve 100% blockage in an event of angina. However, in an event of myocardial infarction, a smaller plaque gets sheared open that achieves 100% blockage, going from 20% to 100%, just for an example. In a matter of seconds, your body has zero chance to develop any kind of a collateral flow. So the symptoms is much more severe, such as, in addition to the chest pain that does not improve even if you rest, you also have sweating, nausea, feel like you're going to pass out, your heart rate is up, and the pressure is unrelenting. It just feels like an elephant sitting on the chest, which is the common symptoms that you hear. So I hope today's video will help you understand the difference between angina versus heart attack, which is a muscle damaging event, which both of them are urgent, but in the case of a muscle damaging event, which is a heart attack, is emergent because time is muscle. So I hope today's video helped you understand what the difference between the two is and what the symptoms of chest pain could mean to you. So again, this is Ethan Wong from Layman's Medical. Hopefully we'll see you next time.